And as unemployment jumps, something that's seeing a major decline is organ donation.
In some cases, more than 50%, depending on the specific type of organ. And our Angeline MCCALL spoke with health experts about the effect the pandemic is now having in this area.
This is by no means an easy time for those who are waiting for an organ. And just to give you an idea of the average wait time for someone who is waiting to receive a heart transplant, it's an average of about 12 months. And this pandemic could mean even longer for a wait for some patients who need it.
What we're seeing is a dramatic drop in the numbers of donor organs available.
Dr. Michael Dickinson oversees heart transplants at Spectrum Health. Nationwide, he says those surgeries have fallen by 50%.
It's really hard to have to put a pause on that. But I think all of us are having to put a pause on so much of our lives.
Across the country, those that are stable enough to wait anywhere from 3 to 6 months for a transplant are now considered inactive on the registry, meaning they'll wait. The number of inactive recipients went from 1,000 in early March now to 3,300.
It is clearly a balance, right? And trying to figure out who is healthy enough, that may sound odd, or maybe I'll put it as not so sick so that they could wait to the other side of the COVID-19 pandemic to be transplanted, versus which are the patients that are so sick that we need to continue to push forward.
While recipients wait, on the flip side, the number of donors has also gone down.
It's very hard. I mean, we spend all of our time trying to encourage Michiganders to sign up in the Michigan Donor Registry to become organ donors, never anticipating that something like this would perhaps limit us.
DORRIE DILS with Gift of Life Michigan says COVID-19 patients can't be donors, even if they're registered, and they have to screen every organ before it's matched.
And certainly, we're doing everything we can when donation is an option to make it happen. But there have been some circumstances that have been outside of our control that have been limiting.
Usually Gift of Life will monitor about 30 patients a day who could become potential donors if and once they are legally declared dead. That number has since dropped to only 4 on some days, partly due to resources available at hospitals.
In hospitals, because the ventilator shortage, the ICU bed shortage, and allowing us all the time that we need to match with the appropriate recipients is difficult for them because they need that bed and they need that ventilator.
In the month of March alone, Gift of Life tells me that they had to turn down more than 50 referrals of patients because they did indeed test positive for COVID-19, which is a significant number. Doctors simply hope that at this point we do not see a strong surge of COVID-19 patients coming into hospitals, because that in turn could jeopardize doing transplants altogether. Reporting in Grand Rapids, Angeline MCCALL, Fox 17 News.